Hi, my name is Dr. Daniel Butts. I'm a board-certified plastic surgeon in Milwaukee, Wisconsin at the Quintessa Aesthetic Centers. I'm going to be discussing kind of an overview of plastic surgery after massive weight loss. This is a very common part of my practice and an important thing to kind of understand the different logistics and considerations and what those different options are for you and when it might be right for you. Weight loss is a very challenging thing for a lot of patients. Unfortunately, with newer weight loss surgeries, GLP-1s, and just more focus on this, I've seen a lot of patients lose substantial amount of weight, which is really incredible how it transforms their confidence, their health. Having that loose skin can really impede on some of those goals. So weight loss surgeries are all about targeting and removing that loose skin and enhancing your contours and ultimately your confidence. So when is the right time for surgery? This is a common question patients ask. Oftentimes you're losing 50, 100, 200 pounds, and that goal weight you might not have totally reached, but we want you to be close to it, meaning 10 to 20 pounds within your goal weight. Ideally for around 6 months is kind of the optimal timing to make sure there's no increased risk for kind of weight regain is the big thing we're looking at. A lot of these different surgeries can kind of impair some of the nutrition balance. Fortunately, with newer techniques and tracking, I think the nutrition issues are less of an issue utilizing vitamins and a lot of the support systems that are present with weight loss. To get the best long-term result, we really want you close to that final weight so you're not losing any substantial weight afterwards either. What are the most common post-weight loss surgeries that I offer? This weight loss and skin laxity can affect all areas of the body. And the order of them can really depend on what your goals are. So the most common thing we do often starts with the abdomen. It often has that loose kind of hanging skin that can irritate, have rashes, kind of bother patients. So whether it's an abdominoplasty or more commonly after substantial weight loss, torsoplasty or lower body lift, there's different terminologies for this, but essentially removing this loose skin all the way around kind of addresses the abdomen in the front and also lifts the buttock in the back to get rid of that and kind of contour everything there. And we can routinely add maybe a breast lift, reduction, sometimes an augmentation depending on what your goals are at the same time to that surgery. So oftentimes we're doing kind of two main areas at one time, and that's a good kind of first combination for a lot of patients. Subsequent surgeries are often targeting the arms or thighs. Sometimes we do additional upper back lifts, or what we call a bra line upper back lift. Again, it really depends on your anatomy and what your goals are. Again, those combinations can vary depending on what bothers you the most, but that's kind of what we typically do for patients. Risk and reality check. Surgeries do have risk. A lot of our pre-consultation and discussion is all about optimizing those risks and minimizing them. So nutritional considerations are really important to make sure that you heal well, but there are going to be scars. We try to place them in easy to conceal area. The abdomen, kind of torsoplasty incisions are normally easy to conceal in underwear. Breast surgeries normally are easy to conceal in a bra. The arms and thighs can be a little bit more visible. Normally that contour trade-off is worth it. And scars do fade with time, so we often discuss different scar therapy options, but they can be a little bit more visible between 3 and 6 months and fade all the way up to 2 years, but they can often be hard to find. The risk of surgery, we always worry about bleeding issues. Those are quite rare. Wound healing issues is probably the most common thing we run into, where along those long incisions, a little suture gets inflamed or irritated. Normally it's relatively superficial, minor. We can kind of just treat that with topical ointments. True infections are very uncommon. Seromas or fluid collections, even with drainless techniques, are quite rare. Fortunately, we can check with ultrasounds to make sure. Obviously, the medical things like blood clots and anesthesia complications are quite low. We want to optimize that using safety devices like SCBs and early mobilization. And when it comes to that final result, realistic expectations are important. It does take stages to get there. There is swelling, so we're there for you during that process to kind of help you along the way and try to give you ideas of how to optimize that. But it does take time to see the full results. So just being patient with yourself and giving your body time to heal. What are the costs, and does insurance cover some of these procedures? So at Quintessa, we don't work with insurance companies because it can often lead to a lot of back and forth and issues and that. And these surgeries are very difficult to get covered by insurance. They will occasionally cover what we call a paniculectomy, where you're just removing just the hanging skin but not changing the belly button or really removing all of it. And only if there's skin rashes, infections, and kind of well documented medical issues that the skin folds are causing. They'll sometimes cover reductions if you can show that you have functional symptom issues like chronic back pain that require multiple bras and chiropractors and things like that, then dictate how much tissue you have to remove. There's a lot more limitations with that. The surgeries themselves vary in cost depending on what areas we're treating, how long the surgery is really what it comes down to. So during the consultation, we give you an exact quote after our discussion and what your goals are and concerns are, so you have a very clear idea of what that looks like. So whether or not you're just started your weight loss journey or you're kind of all the way through it and looking for more options, we're definitely here to help. You can click subscribe and follow this channel. We'll be releasing monthly content to try to provide more educational material here. We do have a link below if you'd like to schedule a consultation so we can, whether that's virtual or in person, to discuss those options with you. I'd like to thank you for listening and tune in for more.